Nose in one way is the first thing that you look at. So if there's any abnormality in the nose, people are going to look at your nose. When the septum is crooked or deviated, the other side is closed or partly closed. He's getting very less air on this side. Hello everyone, I'm Dr. Salman, consultant plastic surgeon. Today we'll discuss one common problem. It's related to the nose. Now, why is it that the nose is so important? Whenever we look at someone, we look into their eyes, the first thing that we notice, it's actually the central face, this one. And in the central face, the middle 1/3 is taken up by the nose. So actually, nose in one way is the first thing that you look at. So if there's any abnormality in the nose, people are going to look at your nose and they are going to stare, unless and until they are careful with their gaze. So we'll discuss this patient. He is a young boy and he had a fall when he was a child. Because of that, his nose led to a complete deviation. You can clearly see that it is going like this and like this. We call it a reverse C deviation. This is also called septal deviation, or DNS, Deviated Nasal Septum. Because of this, there are two problems. The problem is cosmetic. It looks bad, it looks awkward, it looks bad in pictures. He has to be very careful which angle the picture is going to come from. Secondly, it's going to affect the function of the nose. Now, the function of the nose is breathing. Take the air in. Now, when the septum is crooked or deviated, this side is open. He's getting a lot of air from this side. The other side is closed or partly closed. He's getting very less air on this side. In order to compensate this, there is increase in the size of inferior turbinates. Some people call it that there is increased growth inside the nose. That is compensatory hypertrophy of the turbinate in order to control the flow of the air. Now, if such a person goes to a hill station, he's more prone to allergies. He's going to be more prone to runny noses, postnasal drip. He's going to have obstructive sleep apnea. He's going to snore at night. So there are a lot of problems when you snore at night, when you have obstructive sleep apnea. You're not able to have the required sleep that you should. Because of that, you feel tired when you wake up in the morning. That's an important aspect. If your body and your brain has not slept through the night properly, you would never be fresh in the morning. And a lot of people don't even know that the problem actually is not with the sleep, it's actually with the nose. If you're not able to breathe in, body unconsciously wakes you up, change your posture, and then you sleep again. This repeated breaks in sleep leads to ineffective sleep and you feel tired when you wake up. Now we have very good treatment for this problem. It's called the rhinoplasty, one of the commonest surgeries performed worldwide. And it has wonderful results when done in the right hands. I'll first identify the problem. Apart from deviation of the nose looked deviated, plus it looked long, plus it had a wide bony base, and there was also a wide tip. So we did a rhinoplasty. I did a septorhinoplasty in his case, and now you could see even the smile on his face. It's just after 2 weeks, and you could see the smile already kicking in. That's because of the beauty of this procedure. You could see the light reflecting from the center very nicely, a straight line. You can see the nose that has shortened. You can see the septum that has improved. You can see the tip. It's reduced in size because this septum was long. When I straightened it, I cut off the extra part. That's why the nose has shortened in length, just to fix in precisely with his face. So rhinoplasty is both for functional reasons and for cosmetic reasons. Doing a rhinoplasty, getting it done from a plastic surgeon would address both problems. If it's the function or the cosmesis, both would be improved. So any one of you who has concerns with the nose, the shape, the size, the function, the breathing, the pattern, repeated allergies, repeated episodes of sinusitis, drop your messages and questions in the comments. Get in touch with my team. I'll answer your questions in the comments. I'll discuss your cases with my managers. Will discuss that in private consultations, and you can get the surgery done. The surgery is easy. It's about 2 to 3 hours under general anesthesia. You only feel one cannula. The rest you're asleep when I do the surgery. There is splint on for a week. After a week, we remove the splints, and the swelling subsides in about 1 to 3 months, and ultimately you get a result like this. And if you want further details on rhinoplasty, if you think you are the right candidate for it, you can follow the link and read the complete guide to rhinoplasty that I've already done a few months back. That would give you more insight on how to do, what happens in rhinoplasty, what to expect, and most of the patients, alhamdulillah, they end up with wonderful results. It's a surgery that is one of my favorites. I love the change and I love the smiles after rhinoplasty. Thank you.